Okay, knock, knock, knock. Hi, my name is Nina. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Victor 22290.
All right, that checks out. I'm going to go ahead and wash my hands. Close the curtain for privacy. Can you tell me your level of pain today?
0.
All right, awesome. So what I'm going to be doing is a head to toe assessment. So the first thing that I'm going to do is a general inspection. So I'm going to say that your position is upright, you're sitting, you're in good hygiene, you are well nourished. And the next thing I'm going to do is I've already ran your vitals earlier. Your blood pressure was 122/75, your pulse rate was 78, your O2 was 99%, your temperature is 98.6 degrees. And then from there I'm going to assess your skin. Skin is intact, it is warm, it is pink and dry to the touch. And then from there I'm going to do the assessment of your head. So I'm going to inspect your head. Your head is normal cephalic. There are no abnormalities. It's symmetrical, no lice or lesions. Now I'm going to assess or palpate your sinuses. Let me know if there's any pain.
No.
Okay, great. After that, I'm going to do the 12 cranial nerves. So the first nerve that I'm going to test are 1 and 2, which are olfactory and optic. So I'm going to gather my supplies, and if you could go ahead and close your eyes in one nostril. Okay. Can you tell me what this is?
0.
Very good. If you could close the other nostril.
Vanilla.
Awesome. Okay, and then if you could open your eyes and cover one of them. Can you tell me how many fingers I'm holding up?
3.
Very good. Cover the other eye. Can you tell me how many I'm holding up?
2.
Very good. So that means that cranial nerves 1 and 2, olfactory and optic, are intact. The next set that I'm going to do are 3, 4, and 6, which are oculomotor, trochlear, and abducens. So in order to do that, I'm going to take my pen light and my pen. So if you could go ahead and look straight ahead, I'm going to test your pupils. Pupils are equal round reactive to light and accommodation. So now I'm going to ask you to look straight ahead and follow my pen with your eyes. Okay, so cranial nerves 3, 4, and 6, ocular, motor, trochlear, and abducens are intact. From there, I'm going to do 5, 7, 8, and 11, which are facial, or trigeminal, facial, auditory, and spinal accessories. So if you could tell me, go ahead and close your eyes. Which side of the face you feel this on?
Right.
Very good.
Left.
Very good. Can you smile for me? Frown, lift your eyebrows, puff out your cheeks. Very good. I'm going to feel, go ahead and clench your teeth. Very good. Now I'm going to press down your shoulders. Go ahead and lift up. Yes. And press against my hand. Press against my hand. All right. So cranial nerves 5, 7, 8, and 11, which are trigeminal, facial, and oh, I need to do auditory.
Bananas.
Very good.
Oranges.
All right. 5, 7, 8, and 11 are intact, which are trigeminal, facial, auditory, and spinal accessory. The next nerves that I'm going to test are 9, 10, and 12, which are hypoglossal, glossopharyngeal, and vagus. In order to do that, I'm going to ask you to go ahead and swallow. So the trachea is in midline, and you were able to swallow correctly. If you could stick out your tongue for me. I'm going to inspect the oral cavity. Okay. Press up against this. Okay. Press to the left. Press to the right. Very good. Okay. So If you could say ah for me. All right. That means that cranial nerves 5, 7, 8, and 11 are intact. And the cranial nerves 9, 10, and 12, which are glossopharyngeal, vagus, and hypoglossal, are intact. From there, I'm going to move on to the neck. So looking at the neck, the trachea is in midline. There is no breakdowns or lesions. Skin color is appropriate for ethnicity. It is dry and warm to the touch. I'm going to be palpating the carotid one at a time. Okay. Okay. And now I'll be palpating for the lymph nodes. So behind, in front of the ears, under the jaw, and above the clavicle. Okay, there are no lumps found, everything is normal. And now I'm going to listen to the carotid using the bell. Okay. Okay. Carotid pulse is present at a +2 and there's no bruise. The next thing that I'm going to do is the upper extremities. So arms are symmetrical in appearance. They are warm, dry, pink to the touch. I'm going to do the radial pulses. Okay. Okay. And capillary refill. Okay. Capillary refill was in 3 seconds. Radial pulse was a +2. The next thing that I'm going to do is the strength. So if you could grip my hands, there's bilateral grip strength. Go ahead and bend your elbows and resist me when I pull on you. Very good. Can you place your wrists out, your hands out in front of you? Okay. Push up against me while I push down. Very good. Flip them over. Push up against me. Very good. The strength is a 5. And now we're going to do range of motion. So if you could lift your hands above your head. Very good. Abduct them to your sides. Adduct them. And then bend your elbows. Flex your elbows. Down. If you could flex your wrists. Extend your wrists. Hyperextend your wrists. Very good. So range of motion is present and also a 5. The next thing that I'm going to do is inspect the thoracic. So visually things look symmetrical. He is again pink, warm to the touch, and dry. And so now I'm going to, using the bell of my stethoscope, listen to the 5 points of the heart. So I'm going to start with the aortic. I'm going to move over to the pulmonary, Erb's point, tricuspid, and mitral. And here at the mitral, I'm going to hold for 1 minute and listen to the apical pulse. Okay, apical pulse was present at 78. After I listened with the bell of my stethoscope, I would go back through and listen to the 5 points again with my diaphragm, listening for S1 and S2 sounds. So I found that S1 and S2 sounds were present. The next thing that I'm going to do is oscillate the lung sounds. Now there are 12 points on the anterior, which was what I'm going to be listening to with my diaphragm. And I'm going to be avoiding the sternum. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Each time I would be asking the patient to breathe in for me so that I could listen to the lung sounds. Lung sounds were clear and present. Now I'm going to move on to the posterior, avoiding the scapula. On the back, there are 16 points that I need to listen to. So again, with my diaphragm, I'll be listening to those. Okay, go ahead and breathe. Breathe in for me. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and 16. Okay, very good. Lung sounds are clear and present. Next, I'm going to ask you to lay down so I can assess your abdomen. Okay, so visually looking at the abdomen, it is flat. It is warm, dry, and pink in color. There are no peristaltic waves or lumps. So from there, I'm going to listen to the abdomen. Each section, there are 4 quadrants. Each quadrant I'm going to listen to for at least 1 minute up to 5 minutes. And again, I'm doing that with my diaphragm. So I'm starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, vowel sounds are present and normal. The next thing I'm going to do is percuss. So again, starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, and then I'm going to palpate. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Did you have any pain or discomfort? The patient states there's no pain or discomfort when assessing the abdomen. From there, I'm going to do the femoral pulses. So I'm going to check the femoral pulses, which are located in the pelvis. They are +2. I'm going to assess the genitals. So genitals are present. There's no tubes, catheters, odors, hygiene is good. There is no discharge. So from there, I will now be moving on to the lower extremities. Lower extremities are symmetrical. They are warm, dry, and pink in color. I'm going to do the pulses of the lower extremities. So I'm going to start with the popliteal, doing one at a time. Okay. Okay. From there, I'm going to take off your shoes. Thank you. Okay, so I'm going to do the dorsalis pedalis on both feet. Okay, and the posterior tibia. Okay, all pulses were found and they are +2. The next thing that I'm going to do is test the range of motion of the feet. So if you could press up against my hands, very good. Press against my hands again, very good. And now I'm going to ask you to stand so we can do range of motion. Okay, in order to do this, I'm going to have you lift up your right knee, abduct it, adduct it, bring it down. Same with the left side, up, abduct it, bring it down. And if you could extend your leg, bring it back, extend your leg, bring it back. If you can abduct your leg, adduct it back in. Same with the left side, abduct, adduct, very good. I'm going to have you move your foot eversion, very good, inversion, and then the other side. Okay, and rotate your foot internal, external, both sides. Very good. I'm going to have you close your eyes and I'm going to stand behind you so that we can do the Romberg. Okay, and here we're going to close your eyes for 20 seconds to assess first swaying. Okay, patient was able to stand up and balance himself without swaying, and so now I'm going to ask him to go ahead and walk for me. Okay, gait is normal, present, and steady. And now that completes my head to toe assessment. I'm going to document on my patient. I'm going to document all of my findings on skin, cranial nerves, range of motion, and gait. Thank you very much.
What was it?